Good evening and welcome to the Peter C. Alderman Health and Human Rights Awards. I'm Scarlett Fu, an anchor and reporter for Bloomberg Television. It's been my pleasure to be with you for a few years now, in person last year, and today virtually. It's an evening where we'll be marking two occasions. This is the 30th anniversary of the founding of HealthRate. And also, we remember Peter Alderman, whose parents started the foundation after he died on 9/11. They wanted to make sure that he would leave a lasting memory, and I think we can all agree that he has. It's wonderful to see so many people joining us from all over the world. If only Americans were allowed to travel to some of your countries. Of course, the specter of the coronavirus pandemic overshadows so much of what is happening this year. And we'll discuss that with some of the brightest minds in global public health. Now, before we begin, I want to remind you to chat throughout the event. It's not at all rude. In fact, it's welcome. Secondly, you'll see in the chat directions to get help if you have any kind of technical issues. Later in the program, you'll have an opportunity to show your support for HealthRate on its 30th anniversary by texting a GIF or donating online. All right, let's get started now. First up, the Executive Director of HealthRate, Dr. Peter Navarro. He's an innovator in global health programming and research, training opportunities for future public health leaders and thought leadership. It is my pleasure to welcome Dr. Navarro to the stage.
HealthRate is a global health and human rights organization that was founded by Dr. Jonathan Mann in 1990. Dr. Mann was at the forefront of advancing this notion of that health and human rights are inextricably linked, and that link is what animates our work still today. Our work is guided by 5 core principles. We empower the underserved, we invest in local solutions, we advance both health and human rights, we remain until partners can carry on without us, and we achieve long-lasting impact.
HealthRate's work is behind the scenes. It's the stuff you don't see. We're building the infrastructure that undergirds the health system, that enables the nurse on the front lines to deliver that life-saving medication, or the doctor to perform a life-saving surgery. We do everything from training health professionals to working on policy change, equipping clinics, building physical infrastructure, and using technology to increase access to health services. The health system capacity building work that HealthRate does is essential to ensuring access to health systems for vulnerable communities in the best of times. But in this pandemic moment, it is essential. The capacity that we help build in these local health systems can be repurposed and redeployed in a pandemic emergency like the one we're in today. Infrastructure and supply chains can be repurposed. Community health volunteers can be given additional training on COVID in order to deliver life-saving prevention and care information. Equipment procurement can shift to focus on PPE, and operational solutions such as task shifting that was instituted for other high-burden diseases like HIV can be used to help manage an influx of COVID patients. This is why we focus on strengthening community and public health systems, because health needs are always changing. And if we do our job right, the solutions we help design and implement today will serve these vulnerable communities and the health system for years to come. Our field staff have been working tirelessly to support local health systems and communities throughout this pandemic. Let's hear what they have to say.
Hello, my name is Anna Rodzinowska from HealthRate Ukraine. One of our projects teaches social workers and psychologists who work in 12 mobile teams in Ukraine's conflict-affected eastern regions. They provide complex services, including psychological support for the survivors of gender-based violence and social supervision. The lockdown response to COVID-19 has put many survivors of gender-based violence at increased risk as they are forced to stay alone with their aggressors. Mobile teams have adjusted to these changes by increasing their remote response, by using phones and Skype, and by using all the necessary precautions to conduct home visits to respond to emergency situations. Thanks to these mobile teams, thousands of women have received the support they needed to escape these dangerous situations.
Hello, my name is Protas Barasa from HealthRate Kenya. My team is working in Bungoma County to address intimate partner violence, which has risen recently as lockdowns increase unemployment and family tensions. Together with Mokoli Champions Youth Group, we train youth advocates on intimate partner violence prevention. One of these youth advocates is Joan, a 20-year-old student who is working with young people and young couples to empower them to prevent intimate partner violence. It's projects like this and people like Joan who are the key to long-lasting change in Kenya's marginalized communities.
Hello, my name is Killian Fulls, and I'm a volunteer clinician from Health Rights Human Rights Clinic in New York and a doctoral psychology student at Adelphi University. The HRC recruits, trains, and deploys a network of volunteer physicians and mental health professionals who provide forensic evaluation for immigrants seeking asylum and other relief in the United States. Many of these people are fleeing violence and persecution in their home countries. The HRC connected me with Maria, a small business owner in Honduras who fled after she and her family became the targets of violence and extortion by gang members. Using health rights training, I conducted a psychological evaluation for Maria, which not only bolstered the asylum claim, but also helped her overcome her anxieties to testify. After bravely telling her story in court, she won asylum in 2019, and she and her family have begun to rebuild their life in the United States.
Good evening, and welcome to Health Rights' 30th anniversary celebration. We're thrilled you've joined us as we celebrate 30 years of Health Rights' life-saving work. No doubt, you're looking forward to hearing from our distinguished global health experts who will talk about our founder, Dr. Jonathan Mann, and his incredible legacy, the notion of health as a human right, and why it's as relevant today as it was in 1990 when the organization was founded, the importance of ensuring healthcare access to the most vulnerable communities, and of course, about COVID and the global response to it. But first, I'd like to thank some people without whom tonight would not have been possible. That includes Scarlett Fu, our MC and host again this year. We've worked with Scarlett several times, and we're incredibly grateful for her participation in this event. I'd like to thank our 3 event co-chairs, Dr. Greg Janis, Monica Janis, and Kevin Foley. I'd like to thank our 30th anniversary host committee, our development committee, led by Rafaela D'Angiolino Bush, presenting sponsor Bloomberg, and leading sponsors Tom Secunda, Accenture, and Gilead Sciences. I'd like to thank our hardworking staff and board members, and I'd like to thank our global health experts who've taken time to speak with us this evening, including Lori Garrett, Dr. Mary Bassett, and Dr. Vicky Sharp. COVID has certainly slowed our work, like most organizations around the world. Our work depends heavily on person-to-person interaction, and so we've been forced to come up with workarounds either through technology or by adjusting our workflow. But it's also critically underscored the importance of the approach we take in our work. By investing in health systems, the communities that we partner with can repurpose and redeploy those resources that were focused initially on HIV or reproductive health or maternal and child health or mental health. They can repurpose and redeploy those resources to address COVID today and other health challenges in the future. Moreover, COVID has sharpened our focus on vulnerable communities, many of whom have been disproportionately affected by this pandemic. But this is how it is with virtually all health issues. The most vulnerable incur the most hardship. And this is why Health Right focuses on marginalized communities. It is quite simply where the greatest need is and where the greatest potential for positive change also exists. This was true of the HIV pandemic when Jonathan Mann founded Health Right in 1990, and it remains true today. And now I'd like to introduce Dr. Jeff Alderman. In 2018, Health Right merged with the Peter C. Alderman Foundation with the purpose of increasing access to mental health services in the vulnerable communities that we serve around the world. Since that merger, we've worked to expand access to mental health services to all 5 countries that we work in and integrate mental health services into all of the health system solutions that we design. The Peter C. Alderman Foundation's work lives on today as Health Right's Peter C. Alderman Program in Global Mental Health and honors the memory of Peter Alderman. Jeff, welcome.
Well, thank you, Peter. Like many of you tonight, I'm pausing to remember the horrible events that took place 19 years ago tomorrow. It was on 9/11 I lost my brother Peter in the terror attacks on the World Trade Center. Some of you here were very close with Peter, others not as much, and some never knew him at all. But those that did know him can all agree that Peter brought light and life into the lives he touched. When someone was with Peter, at least for that moment, you were his very best friend. You captured his entire attention, and that's what I remember most about him. To honor Peter's memory, my parents created the Peter C. Alderman Foundation, an organization dedicated to providing mental health services to survivors of terrorism and mass violence around the world. If Peter's life could not be saved, perhaps others could benefit from the tragic events of 9/11. In Uganda, Cambodia, and several other countries around the world, the foundation served countless individuals suffering from a variety of mental health-related ailments. Today, people across the globe are now enjoying a sense of normalcy and even prosperity because of Peter's legacy. The Peter C. Alderman Foundation merged with HealthRight in 2018, which led to the creation of the Peter C. Alderman Program for Global Mental Health, which to this day carries on the mission of the original foundation. For nearly 20 years, Peter's friends and family have gathered around the 9/11 anniversary to remember him and raise money for the organization. I'm so pleased that HealthRight has dedicated its annual gala to keeping Peter's memory alive and celebrating his kind and contagious spirit. To those that never knew Peter, and even those that did, I hope you take away the fact that yes, good things can result from unimaginable tragedy. Of course, I would trade everything that's happened since 9/11 to spend more time with my brother. But because I can't do that, I take solace in the fact that you are all here tonight to honor Peter's memory and to continue to support the good work that is taking place in his name. Thank you for supporting HealthRight tonight and for taking time to hear about Peter.
Next, Dr. Navarro will be joined by 3 public health experts. They'll be discussing the founding of HealthRight, the importance of health and human rights when dealing with COVID-19 and racial inequality, how more pandemics are inevitable, and a lot more. You won't want to miss this. In fact, email your friends to join us. Now, first up will be Dr. Victoria Sharp. She is the longest serving HealthRight board member. Vicki was a friend and colleague of HealthRight's founder, Dr. Jonathan Mann, who was the first director of the UN Global Program on AIDS. Dr. Mann and his wife were killed in a plane crash in 1998. Vicki is an infectious disease doctor who ran the largest HIV/AIDS center in the Northeast, St. Luke's Roosevelt Hospital's Spencer Cox Center. Then Peter will interview Dr. Mary Bassett, who was New York City's Commissioner of Health from 2014 to 2018. She is now the director of the FXB Center for Health and Human Rights at Harvard. Finally, Peter will speak with Lori Garrett. She is one of the world's most influential and authoritative writers on global infectious diseases. She's a Pulitzer Prize-winning author who left Newsday in 2004 to join the think tank staff on the Council of Foreign Relations. Lori created its global health program. Now, please enjoy hearing from these remarkable women and Peter.
Dr. Vicki Sharp, thanks so much for joining us. It's nice to see you again. I had the pleasure of working with you on the HealthRight board for many years, and now you're joining our emeritus board, which is super exciting. And we're really thrilled that you're taking some time to talk with us as we celebrate 30 years of HealthRight. You've been part of HealthRight, involved with HealthRight for the majority of those 30 years, and so we thought hearing from you would be a wonderful opportunity to get some perspective both on HealthRight's history and origin story, and also your thoughts on the continued relevance of our mission today. So why don't we start at the beginning? HealthRight, when I joined HealthRight, I was really struck by the origin story, and I recall one of our very early conversations when I was interviewing for the position about HealthRight's origin story. It's really compelling. There's a lot of detail to it, but maybe you could just give us a quick overview of that story and why Jonathan and you and some of your colleagues started HealthRight back in 1990.
Jonathan, as you know, was a physician and had worked in public health and AIDS, and was the first to articulate the need for public health and human rights to be connected. Up until Jonathan, those were two very separate worlds. They had a separate literature, they had separate meetings, and Jonathan said, you know, we really need to connect public health and human rights. And that he articulated the rationale for that was that where you have violations of human rights, you have an impact on health.
Reflect on Health Rights' mission and its relevance to the world today as you see it.
Well, it's interesting in thinking about this meeting. I was thinking about COVID and Jonathan. And if we look at COVID in the United States, who has been most impacted are exactly the populations that Jonathan talked about, marginalized populations, people living in nursing homes, people who are frontline workers, people who are frontline workers, take public transportation and live in crowded housing. So what Jonathan taught us in 1990 about the connection between human rights abuses and public health are very much still present today. What did we learn in the beginning of the AIDS epidemic? Initially, the public health types came out and said, oh, HIV, when we found out it was sexually transmitted, said no more sex. Mm-hmm. The individuals who, particularly in the gay community, said, that's not going to work. That's not realistic. And they needed to be heard. And as a result of their engagement, formulated this whole idea of safe sex, which meant that people could live with the epidemic and survive with a realistic approach. Mm-hmm. And, you know, Tony Fauci, in the very beginning of the AIDS epidemic, after a certain amount of pressure from ACT UP, mm-hmm. put HIV-infected activists on review committees at the NIH. That was unheard of. That never existed. And as a result of that, they got a better product.
Yeah. Well, Vicki, thanks so much for sharing your thoughts with us today, and for joining us as we celebrate 30 years of Health Right.
It's hard to believe.
Thank you for your decades of service.
Sure.
I'm grateful. We're all grateful. And
thank you, Peter.
Thanks. Dr. Mary Bassett, thank you so much for joining us. Really excited to talk to you as we celebrate Health Right's 30th anniversary. Of course, you're the former Commissioner of Health for New York City, and you're now the director of the FXB Center at Harvard University. And so given that Jonathan Mann founded Health Right and also founded the FXB Center at Harvard, and your wealth of expertise, really excited to talk to you today about issues around Jonathan and Jonathan's legacy, this notion of health and human rights that he's really considered the father of, and its relevance to today. I'm hoping to the moment that we're in today, this sort of pandemic moment, this racial justice moment, and I'm hoping that we can get a little bit into COVID. Love to get your take on issues around COVID, our response, global response, and the way forward. So thank you so much for taking the time to join us today. As you reflect back on the HIV response, we're roughly 30 years into the HIV response as well. What are some of the lessons learned that we've either learned or not learned as we try to confront COVID?
Well, I mean, I think we have to all admit that we haven't learned our lessons. I mean, look at the catastrophe that we're witnessing unfolding, particularly in the United States, which, although it comprises less than 5% of the world's population, has between 20 and 25% of deaths. So this is, unfortunately, entirely predictable, given the way we have organized our society and the levels of inequality that have emerged. So I think what Jonathan Mann really did with the framing of health and human rights was give permission and, in fact, demand that people look outside of the healthcare sector. HIV was thought of a problem of a virus and a set of personal behaviors that we were hoping to find a biomedical treatment for. But that wasn't the actual story. That wasn't what was driving transmission around the world. It was It was much more discrimination, marginalization, impoverishment, high levels of military mobilization, gender inequality. All of these things are what Jonathan Mann came to talk about and really demand that the field talk about. And I think that that was an important lesson, that when we see epidemics and pandemics, that they're not purely biological phenomena, that they have to do with our societies. They show us who we are.
As we look to remedy the shortcomings within our healthcare system and beyond, and certainly there are sectors beyond healthcare that are implicated here, and you've made that very clear from your remarks. In broad strokes, how do you think about it as we do think about a future pandemic and learning lessons from this and preparedness? And aside from the really obvious ones around a coordinated response, what are some of the key things from a systems perspective, from a policy perspective, at a higher level?
We're seeing these big gaps, but they're not, and they're not ones that we can attribute only to lack of access to medical care. Not that I don't agree that that's important, and I consider it a human right that people have access to medical care. But we also have the problem of lack of affordable housing. Too many households are way overcrowded. If they have somebody who has COVID, they have no capacity to isolate them, or someone who's exposed, they have no capacity to practice quarantine. Right. And there are just too many households like that. And then there's a large number of people whose jobs are considered essential, who are still going to work, still getting on public transport, still going to, workplaces with assembly line type working conditions where the social distancing, actually physical distancing, just isn't possible. So these are all things that have to be fixed. Yeah. And they're being asked to keep going to these jobs and they don't even get a living wage for them. Right. So people are literally being asked to risk their lives to work in warehouses where the money they earn doesn't really support their family. So all of this is, needs to be addressed, or we will continue to be vulnerable. Yeah, so we have the problem with the public health infrastructure. We have the problem with the coordinated response, but we have these deep social divisions in our society, which will continue to make us vulnerable. And they're related to depriving people of their rights, their right to shelter, their right to, I'm afraid, to vote, their right to leisure time, all of that, as well as their right to health care. So, well,
Dr. Mary Bassett,
does that work for you?
Thank you so much. I really appreciate you taking the time to share your thoughts with us at this really important moment, and for joining us to celebrate the 30th anniversary of Health Right and the great legacy that Jonathan left all of us. So thank you so much for taking the time to chat.
Absolutely, my pleasure.
Lori, hi. Thanks for joining us.
Hi, Peter.
Really excited to have you as we celebrate 30 years of Health Right and Jonathan Mann's legacy. I wonder if we could just start off with you reflecting a bit about Jonathan, his legacy, and the ways in which this notion of health and human rights has impacted the practice of public health globally. You've been you sort of had a front row seat to all of this. So I'd love to just get your reflections at this moment.
Yeah, I mean, it was very obvious from the beginning of the HIV catastrophe that people were paying a price for having a sexuality, for having a lifestyle, for having lovers that were not of the opposite gender. Jonathan came from a medical background, but he was heavily influenced by his brother, who was a rabbi, and long hours of conversations about morality and values. And he very much believed that public health functioned best, not based on its technology and its toolkit, but based on its relationship to the communities it was serving.
Let's shift gears slightly to this moment, this pandemic moment. Is this the beginning of a new era in global health characterized by a sort of triple threat of infectious, chronic, and pandemic disease? How are you thinking about this moment we're in and looking ahead? Is this a new public health era? And if so, what do we need to be doing to address it? It's a big question. What do we need to be doing to address it?
Well, I think it is a new moment, but not the way you describe it. The real new tension, the new dynamic, and the one for which very few people coming out of schools of public health are trained is the biological and other intersections between climate change and global health. When Hurricane Sandy hit New York City with record sea level rise during a full moon, with tidal waves pouring into the city, several of our hospitals were flooded. And all of the flooding meant they lost power. They lost very expensive equipment that tends to go in the basement, like MRIs and radiology equipment, because it's heavy. They lost all their HIVAC systems, which tended to be in the basement. So they became unusable facilities, the hospitals. You start going down the list of health and medicine, and you can see thousands of ways in which we're inadequately prepared to deal with emergency trauma care due to heavy weather events. We have no idea what to do about mass events such as hit Paris about 15, 16 years ago, of heat waves so overwhelming that you lose significant percentages of your senior citizen population in a single day. We're looking at a huge range of climate-related issues that overlap into disease emergence, because as environments change, they release new sets of microbes, and they change the distribution of plant and animal life. If there's a take-home message right now, it's a message that I recently heard former Prime Minister Gordon Brown and former Treasury Secretary Larry Summers issue jointly. And it is this: we're already looking at a scale of global loss to the economies of the planet that rivals anything that's happened since 1929. If we're very fortunate, by the end of this year, we'll be down for GDP in the United States by a mere -8%. Globally, we'll be down by a mere -5%. But if we don't have a vaccine that looks exciting and is actually going into use before the end of the year, or if we have one, we rush it into use and then it has side effects and there's a huge resistance against it, which would be much worse in my book than not having one at all. If we don't have changes in policies that result in enhanced social safety nets instead of directing resources to bailing out, say, like a multinational airlines, then we could very well be looking at a global sum total loss on the order of 30 trillion, that's trillion with a T, dollars to the global economy. And yet still, global health thinks that asking for $1 billion is a big ask. And the climate change folks still think that if they can get, $500,000 for a research project, that's like, phenomenal, right? The ask is not commensurate with the need and with the likely impact down the road. Public health should never again have to make the argument that they're economically justified.
Well, Lori, always fun to talk to you. I really appreciate you taking the time to chat with me and all of the folks who are tuning in to celebrate Health Right's 30th anniversary and Jonathan Mann's incredible legacy. Really grateful that you took the time to join us and share some of your thinking with us on health and human rights and the moment we're in.
Happy birthday, Health Right.
Thank you. And I'll talk to you soon.
Okay, Peter. Thank you.
Thanks, Lori. Appreciate it. Take care. Well, I hope you enjoyed the insights provided by Lori, Vicky, and Mary into the past, present, and future of health right and public health more generally. I'd like to thank all three of them once more for taking the time to be with us tonight. And if you'd like to thank them yourself or make a comment, you can do so right now using the chat function on your screen. The full-length interviews will be available on our website after the event, and we'll share that link with you this evening. Tonight's event is called the Health and Human Rights Awards because each year we celebrate the people and organizations that embody Jonathan Mann's belief in human rights as being essential to public health, as well as our mission, which is to implement solutions that improve the health and well-being of marginalized communities around the world. This year, it's my pleasure to present the Health and Human Rights Community Partner Award to M. Kenny Malindi and their Executive Director, Dawn Abdul. Since 2018, HealthRight has partnered with M. Kenny Malindi on an HIV prevention project targeting members of the LGBTQ community in Malindi, which is located in Eastern Kenya. In that project, we've worked together to deliver HIV prevention interventions that were previously unavailable, including access to pre-exposure prophylaxis, which is a critical medicine that helps HIV negative people stay HIV negative. This HIV prevention projects are really essential, particularly in a vulnerable community like this in Eastern Kenya. We've, again, partnered with M. Kenny, as I said, for the last 2 years. We are very proud to partner with M. Kenny, and we hope that this is the beginning of a long and fruitful relationship working together. Here tonight to accept the award is, again, M. Kenny Executive Director, Dawn Abdul. Welcome, Dawn.
Hi, everyone. My name is Abdul Wahid Hassan. I work for M. Kenny Malindi, an organization situated in Kilifi County, north coast of Kenya. M. Kenny Malindi was founded in 2003 and later on in 2014 registered as a CBO, whereby we started resourcing and trying to get some funds until in around 2015. That's when we got our first fund, which we developed a strategic planning. That is when we also got Health Right International, which came in to support the first and the last pillar, that is health and service provision, and also research, advocacy, and policy reform. So through Health Right International, we were able to create advocacy and also create uptake of PrEP within the two regions, Malindi and Magarini sub-county, and also within a span of 3 months, we were able to actually initiate 200 participants. Within that, we've also ensured that there's a lot of knowledge on PrEP within the area of focus that we work with, and that's the best thing that had happened, of which actually right now we're really grateful because we've been given this Community Partner Award. It will go a long way to actually motivate the peer educators, the beneficiaries that are coming to access the drugs right now, and even the team behind me, that is the clinical team, the program coordinator, and even the board actually is actually excited to be given this opportunity, and we want to give our sincerest gratitudes, and we really acknowledge Health Right International for being a big support to our organization in terms of capacity strengthening and technical support that has been offered from beginning up to now. Through them, we were able to be approved by the county to issue out PrEP. It wasn't an easy step, but with the help and strong support of Peter Navarro, we were able to go through it, and now offering PrEP, hopefully looking forward to become an LT site in the near future with support that might come in by any other donor, probably within you, someone there sitting who might be touched, to ensure that they want to support the community and ensure that we reduce issues of stigma and discrimination and create a space whereby queer people can come to access services. I think that's all I can say, and again, thank you for this opportunity that we've been given. We are really grateful. That's all. Goodbye, stay safe, and God bless you. Thank you.
Good evening, all. I'm Doreen Burrell, a Health Right Board member. We hope you enjoyed those fascinating interviews, and congratulations to M. Kenny. It's now my privilege to ask you to support Health Right's unique and important work promoting health and human rights in marginalized communities around the world. We've made making a donation simple. You can donate on your phone or on the website at healthright.org. Tonight, it's easy to do. Just get out your phone and send a text to 347-671-0988. That's 347-671-0988. In the message, simply type your name or your company name, the amount you'd like to pledge, and any short message you want to share. That's it. Hit send and your pledge will appear live. Of course, you can give anonymously if you prefer. And of course, we'd love for everyone to participate, even if you've already given. A gift of any size matters. No gift is too small or too big. It's my hope that tonight we can raise $25,000. Let's try and make that happen. While you get your phones ready, let me share the impact of your gifts. And please welcome back Executive Director, Dr. Peter Navarro.
Hey,
how are you?
How are you? Good. Thanks for hosting this this live chat.
Well, thank you for letting me be part of this. It's such important work. I wanted to read a few things about what the donations do in different amounts. A donation of $50 covers the monthly living stipend for a frontline community healthcare worker in Kenya. And Peter, I'd love for you to talk a little bit about our community healthcare workers.
Yeah, sure. Thanks, Doreen. The community healthcare workers, honestly, are essentially the backbone of healthcare public health systems in low-income countries. And certainly in Kenya and Uganda, we work extensively with community health workers. They play a pivotal role in spreading health promotion messages. They do some service delivery, but they really play the pivotal role in linking these marginalized communities that we are focused on with the public health system. And so they're really instrumental in the work that we do, and Health Right supports community health workers in a variety of ways, including additional training, equipment, transportation, that sort of thing. I think most concerningly, in many places, community health workers go unpaid, despite the pivotal role that they play, as I said. So this really, there is probably no more cost-effective investment in a healthcare system than in a community health worker.
I so agree with you. I mean, that's amazing that they're out there and they're working with or without help. And it's amazing that Health Right knows that, one of our tenets is building that community healthcare worker up so that they can be sustainable and be there for their communities. After we've set up the program. I just want to mention also a gift of $200 pays for a forensic evaluation for an asylum seeker in New York, supporting and validating their claim for asylum, which I know is extremely difficult to do. So can you elaborate a little bit on how that works?
Yeah, absolutely. And I think this work with asylum seekers in the United States has never been more important than it is today for obvious reasons. This is our longest running program. It's our program here in the United States, and Health Right provides critical service in helping asylum seekers both get settled and access to health services, mental health services, and other social services here in the United States, as well as providing a very unique and niche service called a forensic evaluation. We maintain a network of psychologists and physicians around the country who provide these forensic evaluations that document the signs and symptoms of human rights violations, of torture, of violence. And those forensic evaluations play a critical role in the asylum process. And the numbers speak for themselves. On average, asylees succeed in the United States at a rate of approximately 39%. Health Right clients who benefit from our services succeed in gaining asylum in the United States at a 96% rate. So this service is transformational, and it is truly life-saving. The ability to flee violence and set up a new life here in the United States is a lifesaver for many of our clients.
Right, and so many of those resources have been diminished even as of late, and it's amazing that Health Right is here for 30 years and still going strong, and with the support of everyone who is listening and tuning in, we can continue to do this work. Your support in the amount of $500 delivers highly effective mental health counseling to 50 Ugandan mothers suffering from maternal depression. Let's talk about mothers, Dr. Navarro.
Yeah, let's talk about mothers, and we'll talk about mental health. I spoke earlier about the merger with the Peter C. Alderman Foundation, which is now the Peter C. Alderman Program in Global Mental Health within HealthRight. Mental health is a massive, massive gap in low and middle income countries. It's under, the issues are, I mean, we talk about it a lot here in the United States, but it's really, really hugely overlooked, certainly by funders. And so the opportunity to deliver mental health services alongside the other intervention, or build capacity to deliver mental health services alongside other public health solutions, was just an incredible opportunity. And there are very few nonprofit organizations out there who work in global health who have the capacity to do this. I'm really proud to say that with the addition of the Peter C. Alderman Foundation, we're now one of very few organizations that has deep expertise in developing and piloting mental health solutions for low-income settings where trained mental health professionals are not, they're simply not available. There just aren't enough trained mental health professionals. And so that's one of the reasons why there is a real dearth of services. And so our ability to build the capacity at the community level, at the primary healthcare level, to address issues like maternal depression, for example, as well as PTSD, anxiety, is really awesome, and has, I think, in my view, as we roll this out across all of our programs, increased both the sort of depth and the durability of the interventions that we're implementing.
Right, it goes such a far way to remove the stigma around any sort of mental health, which I think is primary when you're talking about building a community resource to help mothers out and deal with any form of mental health that you might be dealing with. A donation of $5,000 provides emergency housing and social support for 300 women and children who survived domestic violence in the Ukraine. Tell us about that program.
Yeah, so as you and many people who are with us tonight are aware, Ukraine has been engaged in a years-long conflict on its eastern front. This conflict has resulted in mass displacement of hundreds of thousands of Ukrainians, principally women and children. Displacement places women and children at risk for violence, various forms of violence, physical, psychological, economic, etc. For the last 4 years, HealthRight, with support from the UN Population Fund, has been running a nationwide program that identifies women at risk of violence or who have survived violence, provides some services, but essentially what we've done is built a nationwide referral network and built the capacity to sort of identify these women and children and link them to critical services, social services, health services, mental health services. In addition, we've built a network of drop-in centers and halfway houses where women and children can stay while they get their lives back together and come up with a plan. And I think maybe the coolest part of all of this is that we've not just built the system and invested in the halfway houses and the drop-in centers, but that we have begun to turn these centers over to the Ukrainian government, and we've worked with them side by side to build the cost of these services into their budgets so that they are sustainable. And so about 2 years ago, we started handing over mobile clinics and the drop-in centers and halfway houses, and it's been a huge success. And we've served well over 30,000 women in the last few years.
Well, thank you for that. Thank you for that work. Okay, let's see. Have you started texting yet? We're going to see if there's any texting coming up.
Check out the pledges.
And we'll read them out loud. I want to say that I myself am a member. Oh, thank you to Donna Silbert and Kevin Foley in memory of Peter Alderman. $250. Thank you for that donation. And thank you to the Burrell family, that's my family, for contributing $3,000, saying the impact of each member of society's health and wellness is exponential. And thank you for doing this work. Thank you to Tracy Edwards for that contribution of $500. Thank you. You can make a gift online. You'll see that there's a pop-up on your screen right now that you can click to donate. Thank you for the $100 contribution from EH. Thank you for the $250 donation from Doug Window and Tim Legg. So appreciate your work on behalf of the LGBTQ community. Thank you, Dom D. Pasquale. Peter was a friend and a colleague, and I can't think of a better way to honor his memory and the work of Health Right. Thank you for that gift of $1,000. Thank you so much to our dedicated supporters, Liz and Steve Alderman, for this contribution of $1,000. Peter would be so proud, is what their message says. Thank you very much, the Aldermen.
Well, Doreen, we're already up to 8,100.
Wow.
I'm tracking the total amount pledged so far through the drive. I know you said that the goal is
25,000.
So
we can push past 25,000, folks, if you'd like. Thank you. $2,000 from Anonymous says here, for the lives that are overshadowed by social prejudice and systemic discrimination. Thank you from LF. Thank you for your $100 donation. Thank you, Ellen Stryker. And your note says mental health care is a human right. Thank you for that contribution of $150. Thank you for the contribution of $500 from Cheryl Healton. Thank you so much.
Thanks, Cheryl.
Thank you, Anonymous, for your $1,000 contribution and your message of how do you want the world to be different? Because that's what impactful work like the community health systems that Health Right helps build brings into play. Thank you for the $50 from NN. Thank you so much. Thank you, Isabel.
Thanks, Isabel.
Thank you, Isabel Rohrbeck. Hope I'm saying that name correctly. Thank you for your $500 donation. Go Health Right, and congrats to 30 years of great work. Thank you to Rafaela for a donation of $500 in recognition of FOPA's unremitting devotion. That's friends of Peter Alderman's. Thank you. Thank you, Dwight. As mothers go, so goes society. Yes, that's so true. Thank you for your $200 donation.
No better investment than in mothers.
Thank you for your...
Doreen, by the way, we've eclipsed, just so you know, we're approaching 12,000.
Very nice. Thank you, everyone who's participating. Yeah. Thank you, Henry B., host community member, for your $500 contribution, to HRI's project directors and their hard work to make healthcare accessible to all. And thank you for this $100 donation and this note from the Fernandez San Cristobal family, because healthcare should be available to everyone, everywhere. We certainly agree with that. And thank you for your $100 donation from DS. And thank you, Walker Brumston, excited to support this. Yes. Thanks to me, he says to Doreen, for introducing me to the organization. Thank you, Walker, for your $500 donation. Walker. Thank you, Erica Coletta. Thank you for your $1,000 donation, because I believe in Health Right. That's what Erica says, and that's what we believe also. Thank you, Amy Fuller, for your $1,000 donation. Thank you, Peter, and the entire HRI team, is what Amy writes.
Thanks, Amy.
And thank you, Hannah Gould, for your $50 donation. Very much appreciated. Thank you. And thank you, Ann Moeller, for your $250 donation. Thank you for your generosity, everyone. Thank you, Doug Morris, for your $250 donation. The note here, the work Health Right does to connect people to health is so critical, especially now. Keep up the great work. Thank you. And thank you, Brent and Carmen.
Thank you. Thanks,
yes, thank you, Brent and Carmen, for $500. To the entire Health Right team running our programs in the field, thank you for the amazing impact. If it needs to be shorter, I give you editorial discretion. I should have not read it all.
Thank you, Brent.
Thank you, Tina Schweid. Am I saying that right? You know how to say it. Schweik, thank you for your $50 donation in memory of my friend Peter C. Alderman. Thank you so much for that. And thank you for the $200 donation from JV in honor of Vicki Sharp and the late Spencer Cox of ACT UP. Thank you so much. Thank you, David and Andrea Miller, in honor of Peter C. Alderman and in celebration of our son Eli Miller's bar mitzvah this weekend, a donation of $1,800. Thank you so much for doing that.
Congrats.
And congratulations. Thank you for the $100 donation to benefit the amazing work of Health Right International from Travis. Thank you. Thank you.
I know.
Thank you, Adi Divgi, for your $1,000 contribution. Thank you for believing that health is a human right. Wow, we're at a total pledge of 18,500.
All right, we're at 18. Yeah, we're approaching 19,000.
Let's keep going.
We got to get to 25 here.
Thank you, Lombardi Plastic Surgery, Anthony and Yixi Lombardi, for your donation of $250 to Health Right. Thank you for your pledge of $100 to this great organization from Kyla Retzler. Thrilled to support and celebrate 30 years of impact. Health Right is performing a much needed service. As this next donation, I'll donate $100. Thank you, Brett McCullough. Thank you so much for that donation.
Thank you.
Thank you to the Dacey family. Jump in. Thank you for your $100 donation. Sorry, Peter, didn't mean to cut you off.
No, not at all. I did want to, while some of these donations come in, Doreen, I did want to mention that the interviews that you saw tonight with Mary, Vicky, and with Lori were edited down. They were, unfortunately, we just don't have time to show all of it tonight. But I just wanted to reassure everybody who's tuning in. And again, as these donations come in, thank you very much. Thanks for the anonymous $50. Thanks to Sarah Nolan for $500. Really appreciate it. But we will make the full interviews available to everybody. You're going to want to hear what Mary, Vicky, and Lori have to say. We go into a lot more detail about health and human rights. We go into a lot more detail about Jonathan Mann, about the COVID response. Lots of interesting information in there that I know folks would like to hear.
And thanks to everyone who's donated. Thank you to Ellen Keller. Thank you to NGS. I'm in memory of MH and in honor of PE for your donations. Thank you. And if you'd rather give online, you can go to our website now, healthright.org. You'll see a link in the chat, and you can let us know you made a gift and how much, if you like, in the chat.
Yep.
That'd be awesome.
Thank you, MP. $1,000 donation.
Wow,
that's amazing.
Thank you so much.
We are at 21,360.
Thank you so much.
We're approaching our goal.
I need to raise my goal to $35,000. I think we can do it. What do you think, Peter? I think we can do it. Thank you.
Adine, thanks. Adine, thanks for your $50. Peter May, thank you so much. $250. 50 from Anonymous. Thank you for the great work you do. We really appreciate it.
And congratulations on that. And thank you to Health Right and to the legacy of Peter C. Alderman in making the world a kinder place from Ellen Keller. That was a beautiful note. Thank you.
Yeah.
Thank you to RJ, the $100 donation in honor of Peter's hard work and dedication to this noble cause. That's you, Peter. Thank you, Dr. Navarro.
Thank you.
That.
It's a pleasure.
Thank you for this $1,000 pledge sent earlier today. We're happy to support this organization. Great work from EA Global LLC. Thank you so much for your donation.
Thank you, EA Global.
Thank you for the $180 donation from DD. Oh, and thank you, Mario Politaridis, for your $1,000 donation and your note. Thank you to the Health Right and Peter Alderman team for all the critical work you do, especially in such a difficult year for all. Yes, it has been a difficult year, but we persevere. And Health Right is 30 years old because Health Right International has resilience and holds up those 5 tenets. Do you want to talk about those 5 tenets again? I thought they're just an integral part of what Health Right International does.
Yeah, I think it's where the work is really focused on strengthening local health systems. This is about empowering these. I like to talk about Health Right's work in a way that we don't do things to communities as you heard Don talk about. We partnered with Kenny. They wanted to offer expanded HIV prevention services. They work with the queer community in Kenya, which is highly stigmatized. They fundamentally lack connection. There are lots of places where the queer community in Kenya cannot go for healthcare services. And so we worked with them. We partnered with government. We partnered with Kenny, and collaboratively we responded to their need. This was their priority. And we worked with them to help bring the resources to bear on the priority that they'd identified. And that's how we work. That's how we work, whether it's in maternal and child health or reproductive health or HIV or mental health. That's
the long-lasting impact. It really does have the longevity of better health outcomes for everyone. I want to say thank you to Kevin and Donna. Thank you to AB for the $100 donation. Thank you to Kevin and Donna for $500 and the compliments. Thank you so much. I want to read out Imani Moody's note here. I am truly honored to support mental health for marginalized communities, particularly during this time of global reckoning of systemic racial disparities. Thank you for that note. Okay, and thank you.
Thanks to Christian and Rob, who are in Sydney, Australia, joining us where it is Friday.
Right.
So shout out to those guys, and 250 from AA. Thank you. 100 from PS. By the way, we've eclipsed 26,000.
That's incredible. Thank you for everybody's for their participation. I want to say I want to turn it back over to our amazing MC Scarlett Fu right now for some closing remarks.
You can keep texting.
Yes, please keep texting.
The text to pledge doesn't end.
Yes, please.
Thanks everyone, and thanks Doreen. Doreen, you did an amazing job.
Thank you.
It's been quite a night. I hope you're as moved as I am hearing from such smart, thoughtful, and caring people. Certainly, they give us a lot to think about. And I hope you feel smarter than when you joined this event and will leave feeling inspired. We also hope that you have a better understanding of what HealthRight is doing to strengthen community and public health systems. The health system investments that HealthRight makes with your support are having a massive impact. And thank you so much to all of you who donated tonight. Text to Give will remain open for the next several days, so if you find yourself alone with your phone, you'll know what to do. The last few months, we've seen generosity on so many levels. People caring for their families, their neighbors, first responders, and in the case of HealthRight, for people they'll never see. Tonight's event is an example of that kind of compassion. I'm grateful to be a part of this community. I hope you are too. We'll be sending you a recording of tonight's event, which you can share with others. You can also hear the complete interviews with Vicki, Mary, and Lori on HealthRight's YouTube channel. There's a link on the website. In closing, I wish you all good health, and I look forward to the time when we can all come together again, ideally in person. Congratulations again to HealthRight. Here's to 30 more years.
Hi, everyone. I'm back with a special announcement. I believe that we have, well, I know we've surpassed our $25,000 mark. We are at $26,270. Thank you so much for everyone who has contributed. We want to keep going. The text to pledge will be open all night, and we're not leaving yet. If you haven't made a gift, or even if you have, please consider making a final gift right now to help us meet our goals. This has been a truly incredible evening. Thank you to everyone who has made tonight such a fabulous success. Please stick around to chat and enjoy our slideshow and our music. Like I said, text to pledge will remain open all night, and the number will be on your screen. You can also go back to our healthright.org website to keep those pledges coming in. And after tonight, please continue to support us. Please continue to give at the website. Tonight we have raised, well, so far we have raised $31,870. We'll be sure to broadcast to you what else we've raised before the night is over. Have a great night to all, and please remember that health is a human right. Thank you for joining us.